Hey, welcome back, survivalists. I just want to give you guys a quick update about the 2019 novel coronavirus, go over some news, and show you guys why I am kind of freaking out about this and why I'm pretty scared. And I honestly think that it's a very real possibility that we could have up to 4 million cases globally, literally by the end of this month, by the end of February. So today, right now, is February 7th. And yeah, it is a very real possibility. By the end of this month, we could have 4 million global cases. So let me show you exactly why I'm thinking that and show you what evidence I have for that. And let's take a look. So here we are on a website that shows us every single reported case of the coronavirus and every single death. And this website is pulling this information from the WHO, World Health Organization, the CDC, Center for Disease Control, and a few other major organizations, and it's updated daily. I'm gonna have a link down in the comment section to this website because the URL is just too long for me to explain. But you can see currently most of the cases are still in Asia and in China, and we're currently at 31,000 global cases with 638 deaths. Here's what scares me, though. It's a very clear trend that the number of cases is doubling every 3 days. Let that sink in, all right? And you can actually see that plotted on this chart down here, that the number of cases is doubling every 3 days. This is exponential growth, and this is going to get really bad really quickly. So just to kind of confirm that, just take a look here. So on the 6th, we're up to 30,000 cases. 1, 2, 3. On the 3rd, we're at about 19,000 cases. So that one's a little less than doubling, but we go back 1, 2, 3. We're at 11,000 cases. 1, 2, 3. We're at 6,000 cases. 1, 2, 3. We're at 2,000 cases. 1, 2, 3. We're at 500 cases. All right, so more or less, it's doubling about every 3 days. This is really scary, and it's not, I mean, you can see that the growth is actually increasing. Just from these lines, you can see the angles of the lines, and that's what exponential growth looks like. It's going to be like a curve, and eventually going to go almost straight up. So let's just kind of roll this out. So we're at 31,000 cases right now, and today is the 7th. So if we go forward, 1, 2, 3, if my theory is correct, and you can check me on this, we'll be about 60,000 cases by next Monday, the 10th. 1, 2, 3, we'll be at about 120,000 cases on the 13th. 1, 2, 3, we'll be at 260,000 cases by the 16th. 1, 2, 3, 500,000 cases by the 19th. 1, 2, 3, and we'll hit 1 million cases in about 2 weeks from now on the 22nd. But let's keep going out. 1, 2, 3, we'll be at 2 million cases by the 25th, and 1, 2, 3, by the end of this month, we could be at 4 million cases. And let that sink in, that in 3 days, we're going to go from 2 million cases to 4 million cases in just 3 days. So look, you may think that this is kind of a nonsense, but just watch this trend. If we double by next Monday, and then double again by that Thursday, you know that that is the path that we are on. And I've been tracking this. I've noticed this trend about 2 weeks ago, and I've been tracking it for about 2 weeks, and we are continuously doubling every 3 days about. It's not exact, but it's about every 3 days we're doubling the number of cases. This is where it gets really scary. You know, people are saying that, so we've already passed the number of cases of SARS, right? SARS had about 10,000 cases, and we passed that number last week, right? We've now tripled that number. A lot of people are saying, well, the novel coronavirus is not as bad as SARS. SARS had a 9% death rate. Coronavirus only has about a 2 to 3% death rate. And sure, yeah, if we stopped right here at 31,000 cases, that would be true. But what happens when we're at 1 million cases with a 2 to 3% death rate, or 4 million cases, or 8 million cases, or 16 million cases globally? You know, that 2 to 3% is going to be a huge number. We're talking about tens of thousands, if not hundreds of thousands of people passing away from this novel coronavirus, literally in about a month, and literally in the next 30 days. That is why I'm really starting to get concerned about this coronavirus, because it's been following this trend ever since it's really emerged. And so look, I want to kind of show you this map real quick. And I literally check this every day. You can see in the United States all of the confirmed cases that we've had. So in Boston, in Chicago, a couple in California, in Washington State. So it has reached America, absolutely. And if we scroll over here, so here's the reality, guys. Here's the truth. In America, we're not going to see a high percentage of deaths. We have tons of resources. China has tons of resources as well. According to their number, they're seeing about a 2 to 3% death rate, mortality rate, if their numbers are accurate. And we have, some of the best medical facilities out there. And really what these cases need is a lot of them need to be hooked up to a respirator and fed oxygen. And if you can get to a hospital, so even if you were infected with the novel coronavirus here in the United States, as long as you can get to a hospital, more than likely you're going to be fine. You have a 98% chance of being fine, most likely. They're going to hook you up to a respirator, they're going to treat your symptoms, and you should be fine. Unless you already have some sort of respiratory issue, then the chances may be a little bit higher, unfortunately for you. But here's the scary thing, is that a lot of the other countries where this virus is right now do not have the same resources that America and China has. So let's take a look. We can see that we've had confirmed cases in the Philippines, confirmed cases in Thailand, confirmed cases in India. We know that they do not have the same resources as America and China does. China has tons of resources. They're a very wealthy country. Like, the country itself has a lot of money, and they're a very industrial country. They built an entire hospital in Wuhan to hospitalize 1,000 people. They built the entire thing in 10 days. They have those type of resources. They have a large military that's come into Wuhan to provide services and provide food for those people. Thailand doesn't have those kind of resources. The Philippines don't have those kind of resources. A lot of these Middle Eastern countries don't have those kind of resources. So Thailand especially, if it gets as many cases in Thailand as is in China, they're going to be completely overrun and not able to provide the support that these patients need. Their mortality rate is probably going to be higher in Thailand and in India and in the Philippines. It's going to be higher than it is in China. Another scary thing you have to think about is how much of our economy relies on Asia and these Asian countries. How much of your clothes and the goods that we have in America come from the Philippines and come from Thailand and India and China. Once this starts getting really bad, I can absolutely see our country just stopping all imports from Asia. Right? Absolutely, I could see that happening. And this is going to put global travel, it's just going to grind to a halt once all of these countries are as red as China, and there are several million cases in Asia. All international travel is going to grind to a halt, including imports and exports from these countries. So even if the virus itself doesn't spread very widely here in America, you don't have to worry about dying. It is going to affect our economy. It's going to affect our supply chain. We're going to have a much harder time getting access to the resources that we typically take for granted. So we also have a few updates I want to go over today. So the Chinese doctor who was one of the first people to report this coronavirus has actually passed away from the coronavirus. So this gentleman, he was a doctor, and once this thing started, he started picking up on this trend. He started telling his friends and notifying the community. The Chinese government quickly put a stop to that, and they actually made him sign a confession saying that he was spreading lies and trying to arise hysteria in the community. They made him sign this confession, admitting to guilt to this, and they really cracked down on him because they're a very strict communist country. He himself then contracted the coronavirus and has now passed away. So this is kind of scary for two reasons. One, it shows that China is literally trying to suppress this information from getting out. And this just kind of adds to that narrative that China is not reporting accurate numbers. A lot of people are claiming that they're not reporting accurate numbers. So this 31,000 cases, it may be a lot higher than that. The 600 deaths, mostly in China, it may be a lot higher than that. The next scary thing about this, though, is that there's a narrative going around that as long as you don't have a respiratory issue or you're an older person, that you don't have anything to worry about this novel coronavirus. But he was a young man, I think he was in his 30s and healthy, and he passed away from this. It totally dispels that narrative that only the weak among us have to worry about this. So yeah, I mean, it's very sad that he's passed away. Truthfully, though, him spreading the word and getting that message out early before the Chinese government did, it probably helped the international community out. So in a way, he is kind of died a martyr for getting this information out to the public. So another note is that the World Health Organization is having an international meeting of international scientists coming together. They see what I see, that this thing is doubling every 3 days, and they are, taking this very serious, which I'm really happy to see. I'm happy to see that China is taking this serious. I'm happy to see that the World Health Organization is taking this serious, and they're already intervening and getting together and talking about what the next steps are. So they understand that within a month from now, this could be really, really bad. So a new study has come out saying that they believe that the 2019 novel coronavirus is asymptomatic. All right, so what that means is that you can have the virus, not show any symptoms whatsoever, and are still able to spread the virus to other people before you ever show symptoms. And there are other viruses like that, and this has been people's concern from the beginning, and it seems that it has been confirmed that is the case with the novel coronavirus. So you could be incredibly healthy, you seem just fine, you go home to your family, you're playing with your family and your kids and your wife, and you could be spreading this virus to them without even knowing it. You could be going out in public and spreading this virus without knowing it, and that is most likely what is causing such rapid growth and rapid spread of this virus, is that people don't know that they're actually infected. So here's a quote from the article. There is no doubt after reading the NEJM paper that asymptomatic transmission is occurring. All right, and this is from sciencemagazine.org. So, and I've heard other people speculating on this in the past few weeks, and it seems like they finally confirmed this. And this is really scary. You could be going out in public and people around you, they're not even coughing or sneezing or anything, and they could have this virus and it could be spreading to you. So I'm pretty concerned that, that's terrible news. That is bad news that it is asymptomatic like that, and that you could be contagious without even knowing that you're sick. This one kind of caught my eye. Cruise ship in Japan has the most coronavirus cases outside of China. So one cruise ship has 61 confirmed cases of coronavirus on it, right? And that's so scary. That means people have been traveling around the world, probably spreading this virus and not even knowing it. So this is how this is going to grow exponentially. This really could turn into a global pandemic. It's pretty much at an epidemic right now, and it could go to a pandemic, which is just kind of not much of a difference. Just pandemics are global and pretty bad. And that's the trajectory that we're going on right now with this novel coronavirus. So look, if you haven't watched my video yet on how to prepare your family and yourself for the novel coronavirus, you can check that out right here. And keep an eye on the number of confirmed cases. If it continues to double every 3 days, you really want to start taking precautions and start taking this serious.